Hello, Psych 101 students, and welcome to our final video lecture, Module 7, Chapter 15, Learning Objective 10, Treating Autism Spectrum Disorder in Children and Treating ADHD in Children. In the United States, an estimated 12 to 20% of children and adolescents experience psychological disorders. Problems not addressed during childhood or adolescence may persist into adulthood. Children with autism spectrum disorder benefit from structured behavior therapy. The core symptoms of autism spectrum disorder are impaired communication, restricted interests, and deficits in social interaction. These particular symptoms make the children particularly difficult to work with. Changing these behaviors is difficult to do because effective reinforcers are hard to find. If effective reinforcers are hard to find, children with autism show no response to social praise or to small prizes, which are typical reinforcers used in behavior therapy with children. So in some cases, food is the only effective reinforcer in the initial stages of treatment. The tendency to focus on specific details while ignoring others interferes with generalizing learned behavior to other stimuli and situations. So, for example, an autistic child may learn to set the table with plates, but do not know what to do when asked to use bowls instead. So, generalization of skills needs to be explicitly taught. So, in that example, if you want them to also know how to set the table with bowls, it's a whole new, set of training, of behavior modification because the details are different. They don't generalize one behavior to another. Applied behavioral analysis is an intensive behavior therapy used to treat autism. This treatment is based on operant conditioning. Applied behavior analysis involves intensive interaction between children with autism and their teachers and parents. It requires a minimum of 40 hours of treatment per week. Over time, the children increase socially desired and appropriate behaviors due to the rewards they receive for performing these actions. All organisms increase behaviors they are reinforced for. I'm not going to actually talk about the naturalistic developmental behavioral interventions, but I do want you to read that section about it on pages 625 to 626. Parents of children with autism essentially become full-time teachers for years. It's a very tough road. The financial and emotional drains on the family can be substantial. As I said, the applied behavioral analysis requires a minimum of 40 hours of treatment per week. So it is basically a full-time job to help your child to learn to do desirable behaviors. There's good evidence that autism spectrum disorder is caused by brain dysfunction, although the exact nature of that dysfunction is not well understood. There is little or no evidence that any alternative treatment approaches are effective, besides, applied behavioral analysis. But much still remains to be learned about autism spectrum disorder. Okay. Once again, I really have nothing to add here. Is attention deficit hyperactivity disorder, ADHD, a psychological disorder that should be treated, or is it simply a troublesome behavior pattern that children eventually outgrow? Well, some do outgrow it, um, but many more continue to experience the disorder throughout adolescence and adulthood. So it is, most experts agree that it's not something that should be ignored. The most common treatment for ADHD is a central nervous system stimulant, such as methylphenidate, which is Ritalin, or Adderall, is a somewhat newer drug. And we have others now as well, dextroamphetamine, and there are others like that. The actions of these drugs are not fully understood, but they may affect multiple neurotransmitters, particularly dopamine. Once again, we have drugs that help, although we don't really understand how they work. And this is common of many psychotropic medications. Side effects include sleep problems, reduced appetite, body twitches, and temporary slowing of growth. Most therapists believe medication should be supplemented by psychological therapies, such as behavior modification. Some therapists even urge that medication be replaced completely by other treatment approaches whenever possible. Um, it turns out, not turns out, but it depends on the severity of the symptoms. Um, People with more mild cases of ADHD can really learn strategies to deal with their issues rather than subject them to a lifetime of medication. I agree that whenever possible, a better way to go is to use other treatment approaches, um, such as training them how to focus their attention when needed, uh, and there are other approaches that have been successful. But in more severe cases, it it seems that medication, is very warranted. These graphs compare the effects of Ritalin on symptoms of ADHD. On the left, you can see that Ritalin only slightly increases positive behaviors in children with ADHD compared to a placebo. So not much effect on positive behaviors, but it has a large effect, or as you see on the right, of decreasing their negative behaviors compared to a placebo. Um, in some ways, like it's it's the people that interact with the children that benefit, that also benefit the most from a child being on medication. Um, you Teachers in a classroom or parents or whatnot. When you see a reduction in their negative behaviors, it it makes them a more pleasant child to be around. But once again, I always, I I do know that some, that medication is certainly needed in some of these cases, but I always think we shouldn't always just jump to medication right away, and should always consider alternative approaches. Um, Ritalin and Adderall, these are not drugs to mess around with. They are stimulants. They're stimulating the nervous system, and there are certainly possible long term effects. You are kind of wearing, you're engaging the sorry, I'm struggling for you, but let me put simply, you're kind of wearing the heart down in a sense over time. It is just small amounts. But the long term effect, especially if somebody's on a lifetime of the stimulant medication, is that it probably, and many people make the argument that it probably does shorten the lifespan somewhat. It makes a person more susceptible later to heart disease and other medical issues. So I don't think it should be, used unless, once again, it is absolutely necessary. Behavior therapy for ADHD applies operant procedures to reinforce positive behaviors and ignore or punish problem behaviors. In an analysis of 174 studies, which consisted of over 2,000 research participants in total, this analysis found clear support for the effectiveness of behavior therapy. Many therapists advocate combining behavioral approaches with medication. And then the reason the combination works well is that the medication helps the child to control their behaviors enough so that the behavior modification techniques can be more effectively taught. If one of the main symptoms is inattentiveness, as well as impulsivity and hyperactivity, but that makes working with a child difficult, and it makes learning for that child more difficult. So if the medication helps them to control their symptoms and more effectively learn, then you can be more effective in teaching the behavior modification techniques to the child. And so I often think that the medication should be used as a temporary measure while the child learns the behavior modification techniques. Some therapists suggest that medication should be used only if behavioral techniques fail to reduce inappropriate behaviors. So they suggest that this should be our first, attempt is to use, a form of behavior therapy instead of going straight to medication, which is what tends to happen. And that will conclude Learning Objective 10 and conclude our video lecture series.